Sciatica is a medical condition characterized by acute and persistent pain, often accompanied by tingling or numbness, and is due to inflammation of the sciatic nerve, the longest and most voluminous nerve in the human body. Healing times in sciatica can vary significantly from person to person and are proportional to the underlying cause of the inflammation of the sciatic nerve. In most people, about 90% of cases, sciatica resolves with conservative and non-surgical treatments. But what are they? Let's go see them. According to the guidelines dictated by Harvard University, in the initial stages of sciatica, and therefore the most acute ones, generally in 24-48 hours, it is recommended to apply ice to the affected area in order to reduce the inflammation of the sciatic nerve. This is because the vasoconstrictor action caused by the cold narrows the blood vessels and therefore reduces the blood supply to that area, thus acting as a sort of local and natural anesthetic. Remember to never put ice in direct contact with the skin, as it can cause what are called cold burns, a type of skin lesion that resembles those caused by excessive direct exposure to a heat source. It is therefore important to place the ice inside a soft and dry cloth, and only then apply it to the painful area for approximately 15-20 minutes, taking breaks between one application and another. In the acute phase of sciatica, the doctor may prescribe the use of analgesic drugs such as paracetamol and non-steroidal anti-inflammatory drugs, a group of drugs widely used around the world to relieve pain and reduce inflammation, in this case of the sciatic nerve. Muscle-relaxing drugs are also often prescribed, which, as the name suggests, are able to relax the voluntary and involuntary muscles of the body. Thanks to their beneficial effect, they are able to reduce tension and muscle spasms caused by sciatica, which contribute to aggravating the pain. In the acute phase of sciatica, the pain is often so intense that it is difficult to walk. In this case, it is advisable to rest as much as possible, thus avoiding assuming incorrect postures and making intense physical efforts or incorrect movements in order to reduce the load on the spine and reduce inflammation of the sciatic nerve. However, we must not exaggerate, as a prolonged period of immobility favors the stiffness of the joints and muscles, which are already weakened in themselves, thus worsening the symptoms. Once the acute phase of sciatica is over, that is when the pain begins to gradually decrease. Experts recommend starting walking again, for example, taking small steps. This is because walking strengthens muscles, promotes blood circulation, and stimulates the body's ability to produce endorphins, the body's natural painkillers that help fight pain and reduce inflammation. It is therefore important to alternate rest with usual daily activities and moderate physical movement. On the contrary, however, if you notice a worsening of the pain while walking, it is better to refrain from walking until the symptoms improve. In the subacute phase of sciatica, cold compresses can be replaced with hot compresses, for example by applying a hot water bottle or heating pad to the sciatic nerve. It is an electromedical device, similar to a small blanket, that uses the heat emitted to warm the area of the body with which it is placed in contact. In the case of sciatica, it is placed on the lower back, on the buttocks, or on the back of the leg. In this way, the increase in temperature on the painful part causes the blood vessels to dilate and therefore provides a greater supply of blood, oxygen, and nutrients, thus promoting the healing process. The heat also promotes muscle relaxation, consequently reducing tension and improving mobility. In some cases, experts recommend alternating cold and heat therapy once the acute phase of sciatica has passed. This is because the continuous constriction and dilation of the blood vessels reduces inflammation and at the same time loosens the muscles, speeding up recovery times. Physiotherapy treatments are among the first-line treatment options for people suffering from sciatica, although their effectiveness remains controversial. In rehabilitation programs for sciatica, we find some specific stretching exercises that help improve the flexibility and mobility of the lower limbs and back, correct posture, and tone muscles that support the spine. In this way, it is possible to relieve pain and therefore reduce pressure on the sciatic nerve, speeding up recovery times and also reducing the risk of experiencing new episodes of sciatica. The exercises for sciatica must first be performed with the help of a physiotherapist, as he will create a personalized training plan for you based on his medical evaluation. Not only that, he will have to ensure that the exercises are performed correctly to maximize the benefits and reduce the risk of injury, as well as make any changes to the training based on your progress. Only at a later stage, that is after having learned the exercises with the guidance of the physiotherapist, can you begin to perform them independently at home, always following his instructions.